Did you know that one of the most famous medications in the world was discovered entirely by accident? Originally developed by Pfizer in the late 1980s to treat chest pain caused by heart disease, Viagra took a surprising turn during clinical trials. Researchers found that while it wasn't particularly effective for heart pain, it had a remarkable side effect. It induced strong erections. This unexpected discovery led to Viagra's approval as a treatment for erectile dysfunction, changing the lives of millions of men worldwide. But that's not all. What do Viagra and hamsters have in common? Surprisingly, studies have shown that Viagra might help combat jet lag. Research on hamsters revealed that it could help reset their internal clocks faster when crossing time zones. This intriguing potential benefit of Viagra opens up a whole new realm of possibilities for this well-known medication. But what are the downsides to this little blue pill that turns the erectile dysfunction market into a gold mine? Sure, it can work wonders in the bedroom, but let's not kid ourselves. Viagra carries serious side effects that can send you on a trip to the ER. The road to the pharmacy is paved with good intentions and plenty of side effects. In this video, your house doctor explores the risks and side effects of Viagra, ensuring you are better equipped in the bedroom with the knowledge to use it safely and effectively. We also uncover frequently asked questions like, can I mix Viagra with alcohol? Or, is the cost of Viagra covered by medical insurance? Stay tuned. How Viagra works, explained for an 8th grader. So, in short, Viagra helps keep the blood flowing during intercourse, making it easier to get and keep an erection. Here's a simple way to understand how it works mechanistically inside the body. When a man gets aroused, his brain sends signals to his body to get ready for intercourse. These signals cause certain chemicals to be released, like nitric oxide. Nitric oxide makes the blood vessels expand. This lets more blood flow. The chemical that helps this process is called cyclic guanosine monophosphate. Viagra's job. Sometimes another chemical in the body, called phosphodiesterase type 5, PDE5, can stop the blood from staying where it needs to be, making the erection go away too soon. That's what is called erectile dysfunction, or ED. Viagra blocks PDE5, so the cyclic guanosine monophosphate stays in the organ longer. This helps keep the erection. Important side note, Viagra only works with arousal. It just helps the body do what it's supposed to do naturally. The most frequently asked question, mixing Viagra with alcohol? Sure, it's not an instant death sentence, but it's not exactly a match made in heaven either. Alcohol can make it harder to get it up and keep it up, effectively canceling out the benefits of that little blue pill. Plus, you might find yourself on the floor with a nasty headache or worse, a dizzy spell. Why? While moderate alcohol consumption is generally safe with Viagra, there are important risks. Lowered effectiveness. Excessive drinking can make it harder to achieve and maintain an erection, reducing Viagra's effectiveness. Increased side effects. Both can lower blood pressure, and combining them may cause dizziness, lightheadedness, and fainting. Moderation is key, but let's face it, moderation isn't usually what people think about when they're reaching for the bottle and the Viagra. Use your brain before your libido takes over. Alright, listen up. Viagra can be a game changer, but it's not all rainbows and unicorns, especially for older men. Can your body survive the Titanic, or can it survive the side effects of Viagra? Here's why popping that little blue pill can be risky. Common side effects. Simply put, Viagra is a vasodilator originally designed for heart problems. Use it, and you might get more than you bargained for. Headaches, vision changes, even heart attacks if you're not careful. And don't even think about mixing it with nitrates unless you fancy a trip to the ER. As always, know what you're getting into before you pop that pill. Headaches, dizziness, flushing, indigestion, or a stuffy nose. Annoying, but usually mild. Think of it as a small price to pay for some fun. Serious side effects. In rare cases, you might get sudden vision loss, hearing loss, or an erection that won't quit and gets painfully awkward. These aren't just nuisances, they need immediate medical attention. Heart risks. Viagra lowers blood pressure, which can spell trouble for guys with heart problems. Mix it with nitrates, and you're flirting with heart attacks or strokes. Not exactly the romantic ending you had in mind. Interactions with other medications. Older men often have a medicine cabinet full of pills for various conditions. Viagra can clash with some of these meds, leading to dangerous side effects. It's like starting a bar fight in your bloodstream. Pre-existing health conditions. High blood pressure, diabetes, heart disease. If you've got these, Viagra isn't your best friend. It's more like a frenemy that could turn on you. Bottom line, talk to your doctor before you dive in. They can tell you if it's safe and how much you can handle without turning a good time into a trip to the ER. So, be smart about it. Viagra isn't a magic bullet, and knowing the risks can save you from a lot of grief. This video is for informational purposes only and does not substitute for professional medical advice. Always consult with a healthcare provider. Next up, Viagra's price tag. One pill of the brand name Viagra can cost you $70 to $90 or more without insurance. Prices shift depending on the pharmacy. Generic brand names like sildenafil turn out to be much cheaper. Think $1 to $20 per pill, depending on dosage and where you buy it. Most insurance plans laugh at the idea of covering Viagra. Some might cover the generic version, but don't get your hopes up. Coverage is hit or miss. The most dangerous thing you can do is to obtain Viagra off the market without a prescription and without consulting your doctor first. Case study from your house doctor. Meet Robert, a 72-year-old guy with a heart that's seen better days. He's on nitrates for chest pain, but decides his love life needs a boost, so he buys Viagra online. No prescription, because who needs a doctor, right? Robert pops the pill and boom, severe chest pain hits, followed by gasping for air. Off to the ER he goes. Turns out, mixing Viagra with nitrates isn't a love potion. It's a recipe for a heart attack. The ER docs piece it together. The combo tanked his blood pressure, leading to the cardiac event. Robert lives to tell the tale but gets a stern warning. Next time, check with a doctor before playing mixologist with meds. Dr. House's case study number 2. Meet Michael, a 65-year-old diabetic who thinks a quick chat with a buddy is all the medical advice he needs. Curious about Viagra, he skips the doctor's office and decides to up the ante by taking a higher dose than recommended. Because more is always better, right? Wrong. Michael ends up with a painful erection that lasts over 4 hours, a charming condition called priapism. Too embarrassed to seek help immediately, he finally drags himself to the hospital when the pain becomes unbearable. Doctors treat him to prevent permanent damage, and Michael learns a hard lesson. When it comes to medications like Viagra, dosing and medical history aren't just suggestions, they're lifesavers. So next time, maybe leave the experimentation to the professionals. So, what have we learned here? Most people assume Viagra can be a miracle pill, but it's not without its dark side. Mixing it with other meds or ignoring your health history is like playing Russian roulette. If you're thinking about taking it, do yourself a favor. Talk to your doctor first. Don't be like Robert or Michael, ending up in the ER because you thought you knew better. In the world of medicine, there are no shortcuts. Understand the risks, know your body, and remember, popping pills without proper guidance is a gamble. And in this game, the stakes are high, your health. So, make the smart choice, not the desperate one. Your heart and other vital parts will thank you. See you in the next video.